I'm here today to introduce our two webinar speakers. Our first speaker is Lisa Rahman. Lisa is an advanced practice nurse and health educator who serves as SBA's National Director of Patient and Clinic Services. In that role, Lisa serves as a liaison to SBA's Professional Advisory Council and Spina Bifida clinics. She also supervises our National Resource Center and all information and publications produced by the association. She works closely with SBA chapters, developing education days and other programs, and helps coordinate the Spina Bifida Collaborative Care Network. Prior to SBA, Lisa was the National Medical Advisor for the Association for Spina Bifida and Hydrocephalus in the UK, which is now called SHINE. Our second speaker today will be Anna Markowitz. Anna is the Reimbursement Specialist at Hollister Incorporated. In that capacity, she supports the ostomy, continence care, and wound care business units with all HCPCS coding submissions. Anna is a Medicare and Medicaid billing expert and also responsible for training and educating the Hollister field sales representatives on reimbursement and billing, so they can be valuable resources for their customers. Anna also educates and supports the Secure Start Services team at Hollister with all reimbursement information. Without further delay, I will turn the presentation over to Lisa Rahman.
Thank you, Liz. Today we're talking about a very important topic, which is your bladder health and how to protect your kidneys and why urinary catheterization is so important to your bladder health and protecting your kidneys, and why what that process means to you in spina bifida. So let's begin with the physiology of voiding. So voiding involves a very coordinated sequence of events. And so we especially want to talk about how that affects you in spina bifida. The nerves do not function normally at the level of and below your deformity, which means your spina bifida in your back. It usually occurs in the lowest part of the back. The damaged nerves in your spinal cord by the deformity in your back usually cause varying degrees of paralysis, which we call neuromuscular weakness. And that causes a decreased sensation in all the areas below that space. So if you have a deformity in your lumbar spine, and I know you know those names, lumbar and sacral, then everything below that space is going to have a decreased amount of sensation. And that means that it's going to affect your bowels and your bladder. It means that all lower body functions will be affected. So the bladder and the bowels are always affected. Therefore, the connections between the brain, the spinal cord, the bladder, and the bowel do not correctly send messages back and forth. For that reason, sensation and voluntary emptying of the bladder and bowel are not always possible. This is called a neurogenic or a neuropathic bladder. Therefore, urinary control will be very important from very early in life, throughout life. And it's going to be important for short and long-term health. It requires a functioning and urinary system and an intact spinal column for normal urinary control. Because in spina bifida, the spinal column is not intact, urinary catheterization will be important throughout life. Because the neurogenic bladder either does not empty completely, it causes the urine to either back up into the kidneys, which we call vesico-urethral reflux. That will lead to kidney damage over time because the urine will back up into the kidneys. Or you'll have a flaccid bladder, which means that the urine will continually leak into your undergarments, causing incontinence on a regular basis. Or you'll have an uncoordinated way of what we call a tight and twitchy bladder, where the bladder will either leak out or it'll reflux up into the kidneys, and you'll have a combination of both. None of those things is acceptable, neither socially or for the sake of your health. Furthermore, people with spina bifida tend to have a lot of urinary tract infections. Next slide, please. So this is why we catheterize. So clean intermittent catheterization is the primary method to prevent all of those problems and give people not just social continence, but also much better health. There are numerous types of catheters, and they're all beneficial, and each one is uniquely chosen for each person's needs. As we mentioned, the different types of bladder problems that people can have, the tight and twitchy bladder, the flaccid bladder, the person who has the reflux up into the kidneys. We want to talk about all those different needs, as well as the social issues that may affect the person. So all that is taken into consideration by the person with spina bifida and their urologist or their advanced practice nurse when making those decisions. So let's talk about the first type of catheter that's listed on the slide, which is the indwelling catheter. That's a catheter that's inserted into the bladder and stays in place for a long period of time. And it continually drains urine from the bladder, usually into a bag. Often that bag is attached to the side of your leg. And although the catheter stays in place, the bag is emptied on a regular basis. Those catheters are often for people who are not very mobile, and those people are not usually ambulatory people. They also do run a higher risk for having urinary tract infections because the catheter is into the bladder all the time, which means that there's an open area there where bacteria can enter. So let's talk about the next one, which is the external catheter. That stays external to the body, which means it's also called a condom catheter or a sheath catheter, which means it's only available for men. It goes over the penis, and it's not suitable to manage urinary retention because the person has to be able to voluntarily void, or they have to have that flaccid bladder that we talked about, where the urine just comes out on its own on a regular basis. That is not typically suitable for people with spina bifida who have typically have urinary retention and need to be catheterized. So now let's talk about the third catheter, which is the intermittent catheter, which is most typically used by people who have spina bifida. So we'll spend a little more time talking about that one. That is inserted into the bladder each time the bladder is emptied. That can be somewhere between 3 and 5 times a day for a person with spina bifida. It's a straight catheter. It's either lubricated or hydrophilic. It's either non-lubricated or hydrophilic. Non-lubricated means that the catheter is dry, that the person will lubricate it or wet it with water or with whatever lubrication they need, depending on their personal needs. And hydrophilic means that it has a coating that is very moisture friendly in the sense that once it's wetted or once it's rubbed, it's got a coating on it that is actually, it does not need to have. It's a separate set of outside moisture to where it can be friendly to the body. And that's very good for taking along places where there is no outside moisture. It's also very friendly to people who have trouble, where they need assistance or they don't have assistance, or they maybe should not be handling the catheter, and where they maybe are prone to having bacterial infections. So the catheter has its own moisture pack and does not need to be handled quite as much. And then there are no-touch catheters. They're either gel lubricated or hydrophilic. And we're going to go through each of those separately in the next few slides. Next slide, please. So clean technique, which means the user touches the catheter with clean hands. The user uses soap and water. They wash and dry their hands, and they do not need to use a sterile technique. This is not an aseptic or a sterile technique process, and that is the most typical way that catheters are used. Strictly clean hands and clean genitals and clean catheter. It can be non-lubricated or hydrophilic lubricated, which we mentioned before in the previous slide, and can have a straight tip or a coude, which is a bent tip catheter. And they're typically a single-use catheter, which means you throw them away when you're finished. Next slide, please. Types of intermittent catheters. There are no-touch catheters, which are also called sterile catheter kits or closed catheter systems. Sterile or aseptic technique which means the catheter is protected by a collection bag or a sleeve, and that means the catheter is never touched directly by the hands. You use a kit, which means you have sterile gloves. You can see the pack of supplies that is actually on the slide, a very nice set of visuals here, and that includes your lubrication, it includes your catheter, the collection bag, the gloves, and you're going to have a sterile towel here also. It can be gel lubricated or it can be pre-lubed, which I mentioned the hydrophilic in the previous slide. And it may or may not include insertion supplies, and it's also a single-use catheter. Anything that's sterile will be a single-use catheter. Next slide, please. Straight catheters that are non-lubricated, when they talk about smooth eyelets being important, you'll see there's a very nice photo here of a catheter with an eyelet, and they have an arrow going to it. The smoothness is key because inside the urethra, which is where we insert the catheter, and it goes up into that hole on the outside of the body, and we insert that up into the bladder, that hole that we call the urethra, where we urinate outside of the body, that is a very, very tender piece of tissue, or what we call mucosa, that goes into the body. And those eyelets, if there's even a little bit of roughness on those eyelets of a catheter, that can cause irritation, that can damage the tissue or the mucosa of the bladder or any part of the body that it touches. So it's very important that those are very smooth. So that's an important consideration when choosing a catheter that works for you. So I'm glad that's a consideration on this slide. The next point on that is that the user applies an external gel to lubricate that catheter. Without lubrication, there may be too much friction, and the amount of lubrication we put on will adjust that friction. And that friction is what helps us. Some people prefer a little friction when they put in their catheter, and some people prefer quite a bit more friction. It just depends on your body and what you're used to. And that's how we choose our catheters, so that's very important. Once again, straight catheters are usually single-use, and they're usually clean technique, which means we wash our hands with soap and water, and we have clean genitals, but not sterile. Next slide, please. Hydrophilic straight catheters are lubricated with water. A coating is applied to the catheter, as I mentioned before, and this is a coating that's on the surface. So it's put in by the manufacturer. It is not put in by the user, and it's during the manufacturing process so that it becomes slippery and smooth when it becomes wet. So usually you just lubricate it with water, or there might be something within the catheter packet that wets it when you're ready to use it. Many users find the smooth hydrophilic coating more comfortable to use, to insert it and to withdraw it. And that's usually because of the friction that I mentioned in the previous slide. When there's less friction and it's smoother and easier to use, there's less irritation on the soft tissue of the urethra and going up into the ureters, into the bladder. It may be difficult to hold onto and may make a mess on the floor, and that's simply because of the smoothness and the lubrication. Often it's just a matter of getting used to that type of catheter, and it is a personal preference issue that needs to be addressed between the user and the caregiver and or with the doctor or their nurse, whoever's working most closely with the user. It's, again, a single-use catheter, and, again, a clean technique that we're talking about with this catheter. Next slide, please. Another type of straight catheters that are hydrophilic, there are multiple types, and not all of them are created equal. The line I think is very important to remember with this is that there are different strokes for different folks. Every person's body is different. Every person's preferences are different. An important thing to remember with this is that your age and your experiences with catheters may vary. So younger people are used to all the more fancy catheters. Hydrophilic catheters are fairly new technology that have been out just for a few years. So people who are older and have been using catheters longer may prefer something, or maybe used to something and think their preferences are different because they would not have been using catheters for much of their life that have hydrophilic coating. So they may just take some education and some experience in practicing using them, some experience there. So it might just take a little bit of education regarding the addition of water from an external source, maybe getting used to breaking the water packet. And some people just maybe need to get some practice with having a smoother catheter with the hydrophilic coating on it. Next slide, please. No-touch catheters. A no-touch catheter is a sterile catheter or a closed system catheter. It's called no-touch because it protects the patient from getting bacteria into the bladder. And the catheter is made by the manufacturer so that it does not need to be touched and it should not be touched. The design is made so that it's a self-contained system where the user can perform the sterile intermittent catheterization without the use of additional supplies. Everything is included in the system so that it can be used completely, opened, used, and discarded without the patient ever having to touch the actual catheter itself. And this prevents urinary tract infections. This type of catheter is used mostly for people who have immune deficiency issues or who have a problem with recurrent urinary tract infections or other issues where the doctor decides that this is the most appropriate type of catheter for their patient. It is not usually a personal choice type of catheter. Next slide, please. So to reiterate what I said, the benefits of a no-touch catheter, it's designed to reduce getting the germs or those bacteria that cause infection out of the catheter, and it reduces the risk of contamination. The ease of use cannot be questioned because it's all right there in the package. It can be taken anywhere, and everything that you need is in one package, and it's a closed system. Next slide, please. I think on this slide we turn this over to Anna, and I want to thank you very much for your time.
Yeah, thank you. So how does intermittent catheters get paid in the U.S.? There are different types of insurances that pay for catheters. Some of them include private payers. This could be your employer insurance or a Blue Cross Blue Shield or a big insurance like an Aetna. There are Medicaid programs, which are state-based. Depends on which state you live in and to what coverage you have for catheters. There's, of course, the VA and military. That's for the families that have, for the soldiers and their families. And then there's Medicare. Medicare is a federal program that provides health insurance for people who are 65 or older, disabled, or people who have end-stage renal disease. For the majority of this presentation, we will focus on Medicare because a lot of the other insurers tend to follow Medicare's guidelines. Medicare also produces a urological policy which outlines coverage and guidelines for catheters. It really sets a standard for other insurances and providers to follow. We'll dig a little bit deeper into the policy. There are 3 different Medicare reimbursement categories when it comes to intermittent catheters. The first one is A4351, which describes an intermittent urinary catheter that's a straight tip type of catheter with or without coating. It can be silicone-based, it can be hydrophilic. Medicare sets a limit up to 200 catheters per month that the patient can have. The next category is A4352, which describes an intermittent urinary catheter that's a 2-day tip, and that's just a bent tip. It can also be silicone-based or hydrophilic, and the limit is also up to 200 catheters per month. In the policy, it clearly states that a Coude tip catheter for females is rarely needed and justified. It also says that when a doctor prescribes a Coude catheter, there needs to be medical necessity documented in the medical record of the patient. And the third final category of intermittent catheters is A4353, which describes an intermittent urinary catheter with insertion supplies or a no-touch type of system. The limit is also up to 200 per month. And in the Medicare policy, it very clearly says that when a no-touch type of system is prescribed, medical necessity must be documented in the medical record. In the next slide, we have the 5 criteria that can qualify a patient for an A4353, which is the no-touch type of system. And the 5 qualifying criteria are residing in a nursing facility, immunosuppression. The third one is documented vesicoureal reflux. The fourth one is pregnant spinal cord injured female with a neurogenic bladder. And the final one is 2 UTIs or urinary tract infections while using an A4351 or 52, which is the straight or Coude type of catheter, within 12 months. So I wanted to focus on number 5, so we can go to the next slide. In order to prove 2 UTIs, there are specific documents that Medicare requires that the provider or your doctor hold in the medical record. The first one is that there must be a urinalysis performed and documented with the result of 10,000 colony-forming units or more, and then another symptom has to be recorded. That could be a fever, increased urgency or frequency, or any of the ones listed on this slide. The biggest misconception is that if these are not recorded in the medical record, it's like they never happened. So it's very important to work with your doctor and to go see your doctor when something is not going right and have him document all your medical needs so that you can qualify for an A4353, which is a no-touch type of system if you need to. Okay, next slide. Medicare is not the only insurance that pays for catheters or that creates some type of issues when it comes to access for catheters. The Medicaid state programs sometimes are even more restrictive than Medicare. They might cover less amount of catheters per month for patients or not cover them at all. Some private insurances don't cover the whole category of urological supplies altogether, so that creates even more of an access issue. And then, a lot of the time, patients have to pay out of pocket for those. And just a final statement, intermittent catheters are like prosthetic devices. They replace a malfunctioning body part, yet they are considered disposable medical supplies, and therefore there should not be any access issues for intermittent catheters. Thank you. And also I wanted to mention available support. There are some websites that you see on this slide that can really offer the patient or even the provider some additional support when needed.
Okay. To thank everyone for participating in this webinar today. We will make this webinar available online for those of you who were unable to attend or who would like to access this in the future. And again, if you have any questions or concerns, you can go to those resource websites, contact the Spina Bifida Association or Hollister Incorporated. Thank you.